40 is an estimate. I gave a number between 30 and 40.
Charles Cullen confessed to killing 40 people at hospitals in New Jersey and Pennsylvania, but investigators think that number could be more like 400. In an interview on 60 Minutes, he painted himself as an angel of mercy, saying he was trying to ease their pain.
Do you consider yourself a serial killer?
I guess it depends upon a person's definition.
In Austria, in the 80s, a team of killers, a collective nicknamed the Angels of Death. 4 nurses' aides at one hospital killed at least 20 patients, some by forcing water into their lungs. One said she picked patients who got on her nerves.
The 3-month trial of Beverly Allett has...
Then there was Beverly Allett. The English nurse killed 4 children by injecting them with drugs and air bubbles. She seriously injured at least 9 others. At her trial, doctors said she was doing it to get attention. She was handed 13 life sentences.
I don't ever want her to come out, ever.
It's affected our lives too much already. We'll never forget what happened.
All of these cases are part of a study done in 2006 looking at serial killer healthcare providers. It looks at 90 cases from across the world, all with criminal prosecutions. Beatrice Yorker is one of the authors of that study. She is a professor of nursing and criminal justice at California State University in Los Angeles. Beatrice, let's start with getting into the mindset of some of these killers. Why do they do it?
Well, there's a variety of reasons. One of the phenomena that we've looked at is Munchausen syndrome by proxy. And this is, Munchausen disorder is if you make yourself sick to get medical attention. An example is a nurse who injected herself with insulin. She went into hypoglycemic shock to get in the emergency room. They removed her pancreas, and then they figured out she was actually injecting her patient's insulin. Munchausen by proxy is when you make your child sick to get medical attention, and when you make a patient in your care sick to get medical attention. That could be part of the motive as well.
Outside of the book you worked on, do you think crimes like this get enough attention? Because it seems somehow that different murder cases, more sensational murder cases, get more attention than this type of death.
What I tell people when I go around speaking is that the number of potential victims of serial healthcare killers is so much higher than the number of victims of what I call garden variety healthcare killers. The Ted Bundys, the people who abduct children, who abduct women on the street, or, otherwise strangle, murder, bury people. The number of victims is well into the hundreds, and the number of suspicious deaths is over 2,000. Suspicious deaths associated with people who've been prosecuted for serial murder of patients in their care.
Wow, those are some astonishing numbers. You've heard about what we're dealing with here. What's your reaction to this particular case that's happening in Woodstock, Ontario?
I find it very interesting that the possible tip could have been from the nurse. I haven't verified that. In our study, less than 5 nurses even confessed. However, some of the nurses, their behavior got so brazen, so obvious, we wonder maybe they wanted to get caught. So it doesn't surprise me if it came about through her own allowing people to find that out.
Yeah, it sounds like she may have allegedly told somebody who she was at a mental health care facility about this. Beatrice, we appreciate your insight. Thank you for joining us.
Thank you.